Good afternoon, this is Dr. Do again. This video is quarantine special edition video 29, video number 29. You all know now currently is the coronavirus outbreak for a while, for a couple months. And things getting better or worse, fluctuated. And previously we all focused that this coronavirus only affect the elderly people based on the new definition. Specific for the coronavirus, the elderly is 50 years or above. So which means reaching the 50 years or older increase the risk for the coronavirus infection. From some data in the East Coast, like 14% probably for the 50 years old, and probably 20 or 30% for the 65 years old. So start at 50 years old, the risk start to increase. We all know that. So that's the coronavirus related infection. We all focus on those older people or have comorbidities with other medical conditions. However, recently there's some report in the East Coast. There's a couple of deaths in young children, preschool or kindergarten, less than 5 years old. 3 deaths is related to Kawasaki and toxic shock syndrome. The other 2 cases was kind of under investigation, not knowing the cause of the death. And there are 85 people, the young children has been infected or without knowing the cause, not confirmed whether it's coronavirus or not. So since the Kawasaki and toxic shock syndrome usually is not quite common, since there's the news and in the East Coast there's some cases, so I just like to briefly introduce these 2 kind of diseases, what I know, and what kind of otherwise how to prevent it or how to treat it, and what the sign you really need to see the physician, what the serious complications for that. Okay, so let's start from the toxic shock syndrome. Toxic shock syndrome refers to a staph infection. Usually staph infection, because staph has the coagulase. This enzyme is break down the connective tissue or break down the fiber tissue, which prevent the infection diffuse. But since this bacteria has this enzyme, so that's why the staph infection can kind of to be diffused, so make the infection happen and getting worse. And occasionally this bacteria can have the exotoxin infection. What is exotoxin? Usually the bacteria has toxins, either endotoxins or exotoxins. Usually for the gram-negative bacteria, either ROS or, for example, E. coli, infect the body by the endotoxin. The gram-positive bacteria, for example, tetanus, infect the body by the exotoxin. And I said the staph is gram-positive, but the staph infect the body by the coagulase. Like I said, this enzyme to melt down the barrier tissue, the barrier, like the reticular kind of a screen to stop the infection. But this bacteria has the enzyme to break down that, so that's why staph can infect the body. Usually, if the staph had the isotoxin by this staph is circulating the body, can cause the shock. Usually we talk about the shock, a toxic shock. Usually we mention by the gram-negative, for example, E. coli can cause very serious hypodynamic shock. Okay, hypovolemic, hypodynamic shock. And this exotoxin by the staph serve the same purpose. So basically it causes the rash, the blood pressure dropped into the shock condition. In medical terms, shock means hypotension and the consequences of this hypotension. So this toxic shock syndrome is because of the exotoxin circulating the blood, cause the blood vessel dilated and blood pressure drop with associated with the the hypodynamic, which means blood volume decreased, the blood pressure dropped, and rash. That's another significant for this disease. It can be very serious. So usually when we talk about this, the first identified for this toxic shock syndrome is in female. Use the female product to cause this. But now there's there's some children also, of course, for no reason, just the staph infection cause this toxic shock syndrome. So how to prevent this? Staph is the normal bacteria in our skin. Keep clean, hygiene is very important. So and then in terms of treatment, if you find your children has this sluggish, very lost conscious, and rash, hypotension means dizzy, feel like not respond very well, blood pressure, temperature drop, because kids cannot talk that much. If the temperature dropped, rash, go to the emergency room. So this briefly talk about the toxic shock syndrome. Kawasaki is a viral infection caused the vasculitis, and usually the worst complication is the heart aneurysm, and usually occur in the Asian populations. The first case reported by Japan, so that's and the kid might have rash and also fever, hard to bring down fevers and sweating and getting pale, but this kind of kid can have the strawberry tongue, which means the vasculitis causes the punctuated bleeding, and also occur in the body, have those kind of rash. If your children have fever for a couple of days and cannot bring down and feel very sick and with rash and strawberry tongue, bring to the emergency room as soon as possible. In terms of treatment, there's no way you can manage at home. You can give some aspirin, but just temporary. Usually need to be treated with the immunoglobulin to against those antigen-caused vasculitis. So this is the Kawasaki disease. And in terms of whether coronavirus is related to this, I think the scientists or the physicians are still doing the investigation whether those cases are related to the coronavirus for currently. So this is what I meant to talk on, what I know about these two diseases, since they are not quite common. So I just based on the cases, based on the medical standpoint, give you some introduction for those parents if you have kids. Do not think that children are not going to be infected in this special time, and it's possible to be infected. Just make sure, even though it's not coronavirus, but still, like the 85 cases from the East Coast, and the nationwide, it's already call for all the physicians pay attention, and if there's any case, a similar case, they will work together to identify the cause and to develop a treatment. And so this is what this video for. Since it's a quarantine special, so I saw those reports, so I just brought here for those young parents if you have young kids. All right, thank you for watching, and I'll see you next time.